Our crew, they receive notifications from the rangers once a camp is abandoned. We clean up waste, we clean up, abandoned bedding and tent material. So whatever is left when the occupants have left, we clean up, and just trying to return the natural area back to what it was before. Really have continued to see the same things, unfortunately. There's a lot of encampments in a lot of the same areas, and we've seen it increase due to COVID. Well, I guess some people might think that people living rough are criminals or doing bad things, but a lot of people end up in the river valley because they, maybe missed a few paychecks. There's a lot of misconceptions around how a person can end up camping in the river valley. There's a lot of different reasons why a person might be out here.
Our community has done a remarkable job at responding to and providing housing, but since the pandemic and over the last, over a year and a half now, we've seen numbers increase, and we have over 2,800 people on our by name list, which is how we track those folks that we are working with to connect to housing. And a large number of those are either in shelter or actually living on our streets on any given day.
I'm part of the Help Unit team, which is a partnership between Edmonton Police Service and Boyle Street Community Services. We can assist with getting ID, income, healthcare, services for mental health or drug addiction. Our goal is to navigate these folks to the appropriate services so that they can get the care that they're requiring. Good morning. Anyone home? It's Doug from the help team. So you guys been here for a while? Yeah? Were you guys sort of camp more so in front of Hope Mission? Did you get to the hospital? Oh, okay.
It's a lot of work, frankly, to be homeless. There's a lot of having to get into another line for perhaps a meal or another service. So there's a lot of energy that goes into just surviving. And folks certainly deal with a lot of risk, safety risk. So the experience of always being insecure, watching the very few possessions that you may have, and worrying about what to do with those possessions in order to perhaps get some of those services.
Not enough housing, not enough supportive housing, not enough low-income housing, not enough low-income programs. My take on supportive housing is it's freaking awesome when you can get it, but then you're sleeping out here for 15, sometimes 6 months waiting to get on it. And it's like, it's heart-wrenching, man. It's cold at night. It's like, I don't know if I can do this anymore, actually. Fear is just to be here when the first snow falls. Because when the first snow falls and it sticks, we're screwed.
So supportive housing is really a strategy geared to trying to reduce the number of encampments and people sleeping rough in the city.
See, a little bit warmer, eh? There you go.
Supportive housing takes the concept of affordable housing, but it supplements it by also embedding on-site health and social supports. So for people that require some additional support to maintain their housing independently, that's what supportive housing is. So you will have social workers, like nurses, healthcare aides, that sort of thing that are built into the building and help to manage the building and support the residents who live there so that they can live successful, relatively independent lives.
Supportive housing is certainly something that is evidence-based. There's some really great organizations we've learned from across North America in terms of the models that are working. It is a difference in terms of attaching really tenancy. So these are apartments. Folks have leases. This is their home. It's not an institutional response, but the supportive housing becomes really the best solution for folks, where those on-site supports are going to help them get through some of the challenges that they may have in any other environment, just in terms of just maintaining their housing. Right now, when we talk about folks who we might say are hard to house, it's really not that they're hard to house, we just don't have the right housing for them.
I'd have to say that the last couple of years certainly during COVID. And man, are there so many more people out living outside. We actually spend most of our time below bank, which is in the river valleys of Edmonton, so connecting with folks that are living rough. Certainly over the last year and a half, 2 years, the amount of people that are outside, and I mean this is quite indicative around this neighborhood as well, how many camps are around, but certainly throughout the river valley has just exploded for camps and people living rough. Well, here's a card for the street outreach team from Boyle Street Community Services left here on the table. Looking around the camp, it seems like a snapshot of a point in time of someone's life, just sort of frozen in time now.
You do find, remnants of what people had there, and there have been times where we've found, children's toys and other items like that. We don't want to see people struggling in that way. We do our best to be really respectful.
As soon as it was announced, the Rapid Housing Initiative, the money was in our bank accounts within 2 weeks. Like, I've never seen a government transfer happen that quickly. The pressure was really on to come up with a new way to deliver on these ambitious goals as quickly as possible. And basically the only answer was to move to modular construction. Knowing that we could draw on the expertise of our colleagues in integrated infrastructure services really made the decision a lot easier, because we happen to have access to a very talented pool of people who have a ton of construction experience. It was really exciting because it meant that instead of waiting 4 years for 210 new units of supportive housing that are desperately needed, we could potentially have those built in 1 year. I think if we want to fulfill the vision that Edmontonians told us that they want through the city plan, and we want to become a big city that grows and helps its citizens grow, we have to undertake these types of initiatives, because we can't be a successful big city if we ignore the needs of the most vulnerable people who live here.
A belief too about what kind of city do we want to be. Are we a city that we take care of each other, that there's options for people, and that it's not okay to just accept that folks don't have an option other than to either live outside or in a shelter overnight. So that's part of supporting a vision for our community that all of this work really is tied to. And when we think about the neighborhoods that community members will live in, that's also a value system of saying, this is about integrating folks, supporting them as neighbors and not as, people over there that are homeless.
If you think about all the resources that 1 million people can bring to bear, the businesses, the citizens, the community leagues, the city government, the provincial government, the federal government, I would say that there's no way we won't achieve the goal if we try.